Okay, good afternoon. My name is Larry Kidd, Dr. Larry Kidd. I am the Chief Clinical Officer for Henry Mayo Hospital, and we are here today to provide updates regarding our preparation at the hospital, regarding managing patients at our hospital who might present with the coronavirus. We have put in place the screening process to evaluate patients that present to our emergency room or other areas of our hospital in terms of evaluating if they meet criteria for testing for the coronavirus. With that, we are in the process of sending out testing samples as appropriate for patients, and we have screened a number of patients at this point. We have had 3 patients that have tested positive, but are no longer in the hospital. They're not at the hospital in that they were not ill, but they did meet the criteria for testing, and as a result, we have a number of tests that are outstanding, and as a result of the volume of tests that are being requested by the laboratory that does this testing, we are waiting for days now in order for those results to come back. Depending on those results, we act accordingly. With positive tests, there are criteria by which those patients are managed and treated. Negative tests, of course, are communicated, and those patients continue to be monitored, providing there are no acute or issues that require hospital stay. Those individuals are likely at home already because they're awaiting the results. We also have modified internal preparations related to visitors that come to our hospital. So we're screening individuals, limiting the number of visitors that may visit patients at our hospital, as well as a number of other adjustments have been made according to the CDC guidelines, working under those guidelines, as well as the state and local county health department requirements as well. So we're well positioned. Staff training has been completed, supplies are in place, and on a day-to-day we modify our operations to make sure the patients are safe, visitors, and our employees and physicians.
Excellent. And my name is Bud Lawrence. I am an emergency room physician, and I am the medical director of the emergency department here at Henry Mayo New Hall Hospital. And we'll talk about, I anticipate many things today, but one of the things I think that we need to talk about is testing. Dr. Kidd here mentioned that we have a lot of tests that are outstanding in the sense of turnaround times. We find that testing is a very precious resource that we don't want to overload. And nationally, our emergency department, like most all facilities, is adhering to the CDC guidelines for who can and cannot get tested for COVID-19 or coronavirus. So just kind of in big picture, some of the testing criteria would be if you were a healthcare worker and you had a fever or a cough and you had known exposure to somebody who was COVID-19 positive within the past 14 days, that would be an indication to test you. Or if you were a healthcare worker that had fever and a cough and no other explanation for your illness, that would be an indication to test you as well. Of course, healthcare workers, by the nature of our job, are more exposed to patients with potential illnesses, and this would include COVID-19. Also, patients or people in the community who may have traveled to high-risk countries within the past 4 days, and they have fever and a cough, and they require hospitalization. That would be another reason to be tested, as well as if the patient lived in a place like a convalescent home, a homeless shelter, or some other setting where they're among perhaps elderly people, and there are 2 or more patients, including themselves, so maybe 3 patients that have upper respiratory tract illness and symptoms. That is a potential reason to test somebody. And there's also sort of a caveat that of physician determination that is a newer criteria, and that would mean that if the patient has fever and a cough, and doesn't have any of the above criteria that we just talked about, but the physician feels that there is a significant historical or clinical finding that would make coronavirus or COVID-19 very likely. So those are kind of our big picture testing criteria. They're a little more granular than that on paper, and they can be found at the LA County Department of Public Health website under coronavirus information or COVID-19 information if you'd care to look that up. But I think the take-home message is if you feel like you have coronavirus or COVID-19 and you went to a physician or a provider or perhaps even our emergency department and the decision was made to not test you, please don't take that personally. It's not like we don't value you any more than we value anyone else. It's just that we really do need to adhere to these strict testing guidelines. Otherwise, the system will be overloaded and the turnaround times for these tests will be unacceptable. So that's where we're at with information on testing. Oh, we have a question. I said traveled in a place for 4 days. It's 14 days. Sorry, misspoke there. Thank you very much.
Okay, a couple of questions that have just come in. First, what were the ages of the patients?
I'm sorry, but we can't release any of those. So that's a great question, only in the sense that we get this question all the time. What were the age of the patients? Where does this patient live? Is this patient in my neighborhood? We understand that there is a heightened level of anxiety in the community, but fortunately for patients in general, we have to adhere to patient privacy law regulations, and those are very clear-cut. There is no way that we can distribute any of that information. We need to protect the privacy of our patients just as you'd wish your privacy were protected if you were a patient for any reason.
Right. Do be assured that those patients are appropriately followed and they receive the proper medical attention ongoing. So that is our priority, is keeping the patients safe and make sure they receive the appropriate follow-up care.
And another additional point to that, to add on to what Dr. Kidd said prior about notification of the Department of Public Health, which is a mandatory notification. So anyone who's positive, the Department of Public Health is aware that they're positive, and they are going to follow up appropriately to evaluate what prior contacts that COVID-19 patient may have had, what their interactions with the community may have had, and they will help identify any other at-risk community people that could have been exposed by this patient. So it's a very good question. I think you have to have some trust in the system that they will be handling that appropriately.
Can you discuss how many tests are currently outstanding?
I'm sorry, that's again information we cannot release. Really, the hospital stance is that we are publicizing or reporting to the Department of Public Health how many positive results we have had. And unfortunately, at this point and ongoing, that's the only actually valuable information that should be released.
Do you know how many cases are currently in the Santa Clarita Valley?
I can take that. So the answer is no. So even when you look at all the data thus far, and people talk about case fatality rates, they talk about infection rates, all these things, it only relates to the amount of people that were tested and were tested that were positive. I think it's important to understand that with this COVID-19 infection, the overwhelming majority of patients will have a very mild course of illness. People that get this infection, majority of them will have a mild course of illness. And that means that many of those patients don't go to their physician or don't get tested. It's very similar to a common cold. So when you look at how many patients there are in the Santa Clarita Valley, we know the virus is in the valley, we know that it's here, but there's no way to give that accurate representation of a number.
Right, and just to tack on to that, that's why it's so important to exercise all of the requirements and recommendations of the health department, including the first line of defense is good hand washing, washing frequently, ensuring that you maintain the distances from individuals that's recommended, that sort of thing. So at this point, it's assuming that individuals could be anywhere. So just because you have a number of positives doesn't necessarily mean there aren't individuals around you in the community that could be also without symptoms, and therefore we would not know that they were positive.
And to add on to that, it's very great information. We do know that certain subsets of our population are at higher risk for having complications from this infection. That would be elderly, people with other medical issues, things like heart disease, chronic lung disease, and perhaps diabetes, and also people whose immune system doesn't function like it normally should, people who either have immune system diseases, or perhaps you're on medications that lower your immune system, thinking things like chemotherapy medications or steroids, those kinds of things. So we know that those patients are at higher risk. So really, the recommendation, essentially, as Dr. Kidd put it, is to try to distance yourself, and if that means staying at home to be safe, if you're a high-risk person, I think it's a wise recommendation.
So this question's 2 in 1. Is having a normal cough okay? And is it true that if you hold your breath for 10 seconds, you are okay?
So having a normal cough is probably not okay. That's a sign that something is going on. Normally when we sit in our normal state, we're not coughing, but it could be absolutely nothing to a normal viral infection. So having a cough in and of itself does not mean that you have COVID-19, and it does not mean that something dangerous is going on, not that COVID-19 is overly dangerous. I would say to you that holding your breath for 10 seconds would have no bearing on anything relating to any type of viral infection. So unfortunately, although that sounds like a great remedy and good idea, I don't know that it would help.
Another question came in. Is there an underlying case or common case to these symptoms and these signs of positive tests that you've seen?
Again, we can't disclose any of that information, correct, Dr. Kidd?
Yes.
We can't disclose any information relating to any of the positive cases we've seen. What I can do is I can tell you in general, based on almost 56,000 patients in China, what symptoms were most common, and that would be things like 90% of the patients had fever, 68% of the patients had a dry cough, and a little over a third had fatigue. And also I can tell you that symptoms that are not consistently happening in patients with COVID-19, only 5% of those patients had nausea or vomiting, only 5% had a runny nose, and only 4% had diarrhea. So that would mean that if you had a runny nose, could you have COVID-19? You certainly could, but the chance of that is very low based on the information from a very large subset of patients.
Right, and do keep in mind that the vast majority of patients that contract the virus will have mild symptoms and be completely relieved of those symptoms without having known that they ever contracted the virus. So maintaining, again, a healthy lifestyle in terms of hand washing and eating, proper diet, etc., will all help to boost the immune system and aid in recovery should you come in contact with that virus or any other for that matter.
And to piggyback on that actually, what would you do if you did have this virus? Dr. Kidd mentioned that most people get better on their own, and really there aren't really any strong recommendations for any medications or anything that can help with COVID-19. It's really going to be just like your common cold or even regular viral infections, which is rest, hydration, and Tylenol and or Motrin for fever control or any discomfort. So that's important to understand.
Right, and to remind everyone that should you have questions or feel that you might be experiencing symptoms, the first contact is with your primary provider to contact your physician or whoever it is that you see normally for your health care, and they'll be able to help screen and guide you in terms of whether or not you need to be seen, or if this is something that you can remain at home and take care and progress through a normal minor illness as you might otherwise. So first course is to contact your provider. It is not necessary and discouraged from reporting to the emergency room for such testing. And as Dr. Lawrence indicated, coming to the emergency room will not necessarily mean that you're tested. The testing is based on criteria that he outlined, and that is to ensure that those that do need to be tested were able to get their test in the system and get the result back timely. So very, very key in terms of following up.
And I do think if you don't get tested, it may be upsetting in that moment, but it's actually a good sign that you don't meet the criteria for COVID-19.
Great. Do you have time for more questions?
I don't
Okay.
so.
What are common symptoms in children? Do they differ at all?
That's a great question. It's a great question in the sense that what we've seen is children tend to not get the infection quite as often. So we do see that the populations that are at risk are, we talked about before, but of older age. So younger age children, for whatever reason, or children in general, tend to be more resilient to this infection, tend to not get the infection, but the symptoms would be the same. It's not, there's no differentiation of symptoms that I'm aware of, but it is a great question, but for whatever reason, our children, thankfully, seem to be at low risk.
If I live with my mother of 84 years age in a small place, how do I isolate if I become infected or find out if I have been in indirect contact with someone?
So if you did get a positive COVID test, the first thing that would happen, even when you get tested, anytime you meet criteria for testing, all those people get, if you're well enough to go home, which overwhelmingly, the majority of people that we test go home. It's not like when we test people, my goodness, they have to be in the hospital and they're super sick by any stretch of the imagination. When you get sent home, everyone that has been tested needs to be on home quarantine until that test result comes back. And not only that, but your family members should also be on home quarantine. So it brings up a fairly sticky situation if you had an elderly person in your home, because you don't want to expose that elderly patient or person to COVID-19. And that's where the things like hand washing, distancing, really we recommend greater than 6 feet seems to be the safest recommendation right now. If you're gonna sneeze or cough, make sure you either sneeze or cough into your elbow or cover your mouth. Use hand sanitizers, try to keep that elderly person in a separate part of the home. You'd really want to distance them, although they would still likely need to be quarantined based on you having met criteria for testing.
Just a comment to add on to the previous question about reporting for testing. I do want to emphasize, just as in the case with any other condition, if you feel you have a medical emergency or you are in distress, having shortness of breath, those kinds of symptoms are emergencies, and you should call 911 as you would ordinarily. So don't hesitate to access the emergency room for conditions in which you're distressed or you feel you have a medical emergency. We are here for that purpose and encourage you to utilize our services if you have an emergency.
And I would like to add to that, keep in mind that our first responder heroes that are out there, that are the people that come to your house when you call 911, they have families, they are people. We'd love it if you would be able to respect them and let your first responders know that you've had a cough or you've had a fever. In this time when we're dealing with COVID-19, it's more communication is better than less communication. I wouldn't advise you not to tell anyone that you've had shortness of breath or cough and a fever. Please make that one of the first things that you mention to them if you're able to. Our first responders are a precious resource, as are all of our medical professionals that come to work every day on behalf of our communities. So please be as forthright with the information as you can. We certainly appreciate that.
Yeah, very, very important.
One more question before we wrap up. What does a standard COVID test involve? What does it look like?
So these are great questions, everybody. Thank you so much from the Facebook world. So there are two types of tests that can occur. One is the test that's done by the Department of Public Health, and one that is being done by outside companies. Some hospitals rarely will have it in-house. The test that goes to the Department of Public Health involves either a specimen from in the nose or in the back of the throat, as well as a lower respiratory specimen, which would be some phlegm, basically, that you'd cough up. So they need both of those specimens, or they would request we send both those specimens. For the testing that we do here at Henry Mayo and most places, it is just the nasopharyngeal or the nose swab, which is the same swab we do for influenza or RSV, other viruses. Or we could do the throat swab. We tend to do the nasal swab just because that's part of our workflow as it is, and it's fairly well tolerated by the patients.
Great. Those that are watching, if you have any more questions, feel free to put them in the comment section below, and we at the Henry Mayo New Hall Hospital staff will do the best to get back to them shortly. Thank you.
Thank you.
Okay, thank you.